Hello everyone. We are back with our first episode of our series on the occasion of World Newborn Care Week. So when we invite somebody home, we prepare a lot. Then imagine if it is a newborn, if it's a new life into our world, what and how should we prepare? It's a lot more, right? So talking on this, how should we prepare? What should we prepare? What all to be prepared, especially when bringing our new little ones home? We have our expert, consultant, head department of Neonatology, Dr. Aparna, with us to talk on how and what we should prepare when we bring newborn home. Hi, Dr. Aparna.
Hi, Dr. Sukesh.
So, madam, when we bring a little one's home, this is a lot more excitement.
Yes.
So, it is not just the mother who actually has to prepare herself in raising a newborn. The entire family, the old siblings, father, the entire family has to prepare in bringing a newborn to the home. So now could you please educate all of our viewers on how to prepare the home and what are the most essential items to be bought before bringing a newborn baby home?
Absolutely. Welcoming a newborn baby into our family is always a great joy, and with this joy comes a lot of responsibility. So one of the first things we plan is an ideal room where the mother and the baby can be kept for the first few days after the birth. So this room should have a proper temperature. Now most of us at home, we will not be having a room thermometer. So an ideal temperature for a newborn baby would be that temperature where an adult wearing a full hand shirt might feel just a little bit warm and uncomfortable. That would be the right kind of temperature for taking care of the baby. So in a place where the environmental temperature is very cold, say like in a hill station, it may be good to even plan some kind of room heating to keep this room exclusively for the mother and baby. Now also there are a lot of things which one can plan and buy well in advance before the baby arrives. So to mention a few, the mother may need help with feeding. So if one is anticipating a preterm baby, for instance, it may be a good idea to buy a breast milk pump. Most mothers may benefit from having exclusive maternity clothes, which may be easy for them to feed the baby. Now, there may be a need for equipment for expressing and storing milk based on the requirement. So, exclusive milk pumps and then bottles or utensils such as palada, cup and spoon for feeding this to the baby may also be required. One may also want to keep at least 8 to 10 sets of clothing for the baby. Based on the temperature of the region, we may plan either cotton clothing for places which are hot, and then if the place is cold, one may also have to plan woolen clothing accordingly. Along with clothing also comes cap, socks and mittens, which are absolutely essential at least during the first 1 month of life. Now in addition, depending upon the scenario, one may also want to have infant car seats where we may have to kind of move the baby from one place to another, be it from hospital to home for the first time as well. So these are all some things which the family may want to plan well in advance and procure. And there are a lot of ready-made newborn baby checklists available so that one can constantly go back and check whether we have actually gotten all the requirements.
So you've covered the most fundamental aspects of what should be the most essential items that a family should procure before the baby is brought home. Thank you so much. And madam, this is not just the mother, as we already discussed, who has to prepare. While she prepares herself physically and emotionally to have an attention to the baby, the role of the father is very important. Absolutely. At the same time. So what as a neonatologist would explain or would counsel your couples, the fathers of your babies, on how to prepare?
Very rightly said, Dr. Sukesh. The role of the father can never be underemphasized. So first and foremost, the father plays a very important source of support to the mother who is undergoing a very stressful transition, during the postpartum phase. So she would have a lot of physical exhaustion. sleepless nights, and then there is the constant cycle of feeding, changing diapers, etc. So every mother needs tremendous physical, emotional support, and this is best provided by the father of the baby. And in addition, of course, the fathers also would be involved in financial planning. With due credit to both parents these days, both the mother and father invariably play an important role in the financial planning, say in terms of managing the cost of the delivery, and then the subsequent cost of baby care, procuring the vitamins and supplements which babies may require. Some babies may require milk supplements, etc. It is also very important for the father to step in and make sure that the mother's time and energy is used exclusively for the care of the baby, and she be relieved from other household chores like cleaning, other domestic commitments, maybe care of the elder sibling wherever that is applicable. So the father plays a tremendously important role in welcoming a newborn baby into the family.
So while the attention entirely goes on to the mother after a delivery, the role of a father is critically important, and that you have emphasized a very great manner, madam. So in these days, we generally don't see the parents of couples staying together in their homes. But yes, in the olden days, the role of grandparents was also very critical. So especially in these generations, when you have been counseling all of your parents of the newborns, how did you feel, and what is the role that of grandparents have you seen in the especially in these generations?
So obviously the role of the father, although so vital, one must also understand that one of the two parents may have to actually get back to work very soon. So inevitably fathers may have to get back to their office or back to work maybe in a couple of weeks. So then the role of providing emotional and physical support, intellectual support to the mother becomes one of the prime responsibilities of the grandparents. So be it maternal or paternal, the grandparents would not only provide sort of physical support in day-to-day work, such as maybe taking care of the baby's needs, changing the diaper when mother is busy, or probably if it's a preterm or a low birth weight baby, the mother may be able to express breast milk and the grandparents may be able to feed this milk. Not only this, but in also providing emotional support to the mother. Very often we find first-time mothers having a lot of anxiety about whether they would be able to be confidently take care of their babies, whether they may be able to provide enough milk, etc. So when the grandparents provide them that kind of moral support and confidence, things become extremely easy. If it's a preterm or a small baby, the grandparents may be also able to provide kangaroo mother care, which is one of the aspects of providing emotional bonding and gentle support and thermal care for the baby. So anybody can do KMC provided they are willing, interested and confident in doing kangaroo mother care for the baby.
Right. So it means what you say is the role of grandparents is not just in taking care of the baby, but providing physical, moral, emotional support to the parents as well, and at the same time helps in building the good relations with the baby as well. Yes. That's very interesting. At the same time, madam, especially if the baby is not a first one, when couples have already got older children or older siblings at home, preparing them to bringing the newborn baby home is also very important. Orienting them to the newborn child,
true,
their relation with them is also very important. So how do you want the couples to prepare the older siblings or children at home?
So this is again a very important aspect of family's preparedness for welcoming a newborn. So when there is an elder sibling involved, it is very important to make sure that the sibling does not feel that he or she may be compromised or may not be getting sufficient time from the parents. So this should be repeatedly emphasized to the child. It may also be interesting to kind of prepare the child emotionally for taking care of the younger one. maybe by providing a teddy bear or a doll, and then kind of trying to say that you are going to have a younger brother or a sister, and you're going to take care of the baby just like you're taking care of your teddy bear. So this gives a sense of responsibility to the baby, and the sibling actually feels part of this part of welcoming the baby and taking care of the newborn baby.
Right, very interesting. At the same time, madam, while we were talking about the family preparedness who involves mother, father, grandparents and siblings, thank you so much madam for providing all the wonderful insights on how a family should prepare in welcoming a newborn baby. So I hope you watched this video and you liked this video. Thank you so much for watching this video. So these are all the most fundamental aspects on how to welcome a newborn baby home. So stay tuned to watch our new episode on breastfeeding. Thank you.